Hello. Welcome to the introductory video to the Mental Illness and the Movies module. I'm trying to do three things in this video. I'm going to introduce myself a little bit. I'm going to introduce you to the module, both the learning objectives and how we're going to go about teaching and learning in the module, and a little bit of what's going to happen next. So a little bit about myself. So my name is Carlos. You might have met me in year 1 or 2. I give the occasional lecture. I am at the moment the module lead for year 4. That's who I am in the medical school. I am also a child psychiatrist. As you can tell from my accent, I'm from Spain. And for the context of this module, I think there's two things you need to know about me personally. One is that films are really important to me. They've played a big role in my life and my development. I'll tell you a little bit about that. And the second one is that this module came out of my frustration about medical education, and it's also very important to me. Okay, so the first thing, how come movies are so important to me? I come from an age where there was no internet, there was very little television. I lived in a small village in Mallorca as I grew up, and I was an only child. I didn't have many people in my village I could talk to, and I spent a lot of time living in my own imagination. If I was another type of child, I would have been a bookworm, immersed in books and things like that, but I happen to be a bit dyslexic, so reading is very difficult for me. So growing up, going to the cinema and watching films was the only way I had to get myself out of my little social context. And I was aware of this when I was a child, that the films were very important, and it's almost like life happened in films. Yes, as it happened, most of the films I watched were English or American. That's how I came to learn English and how I came to be in the UK. So playing films. Films were also very important in my education. So when I was a medical student, I spent as much time going to the cinema as I did going to lectures. And that's because I was still aware that I learned more important things. And I'll give you a little story to use that as an example. I went to a lecture on learning disabilities in my preferred subject, which was psychiatry. So a good lecturer gave this talk on learning disabilities, and as part of his very boring lecture on learning disabilities, he mentioned autism. He said autism is a type of learning disabilities. Some kids with autism have savant abilities, but you won't come across them because they're all in institutions. That's all I learned about autism. I made a note saying, do not need to revise. There's no way they're going to ask this in an exam. The same day, I went to the cinema and I saw a film called Rain Man, which completely blew my mind on the intrinsic kind of structure of the mind and cognitive processes and autism, and really made me interested in the subject. And I remember thinking then, why can't lectures fire my imagination like films do? Yes. So that's a little story of how come film is important, and that leads to the second bit I want you to know about me, which is that I am a committed medical educator, and that this comes more, as you can guess from the story of Rain Man, from frustration with how bad the experience of becoming a doctor was for me, and how aware I am that we are not doing a very good job making young, interesting, bright people interested in medicine and mental health and becoming a better human and a good doctor. And this module is a response to those two things: my love for film and my frustration with how I perceive medical education to be inadequate as to what's supposed to be. The second bit I wanted to talk about is tell you a little bit about the module, the objectives, and how it works. So the objectives, what I set out to do when I do this module, and what I propose we all learn about whilst we're doing this module, is that we need to focus on learning 5 things. Yes. So the first one, which is why I think you signed up to this, which is to learn about medicine, to learn about psychiatry, to learn about mental health conditions like depression and autism, and be able to understand them and remember them in a way that will help you pass your exams, and it will help your patients when you practice. So learning about mental health and pathology is one of the big objectives. The second one is that there is something about learning about mental health and psychiatric conditions which is inadequate, in the sense that you can know a lot about depression, but it's difficult to understand just how depression affects people and families from reading textbooks or even meeting patients in hospitals. So there's a second aspect, which is the human experience and the human cost of psychiatry and mental illness, that I hope this module will help you understand better than reading psychiatry from textbooks. The third bit is that I am setting up to teach you a little bit about art and the philosophy of experience and learning and cinema. So coming out of this module, you probably will have picked up understanding of how cinema works, how art works, and how you can learn from cinema. This takes me to point number 4, which is the idea that there is a lot to be gained from learning how to learn in the humanities. So the fourth point of this module is that I want to draw up just how important the humanities are to medicine, how important it is to you that you are able to learn about human beings and medicine from the humanities, not just from biology and biochemistry and physics and microbiology, which are all very important sciences, but that there is something about humanity and being human which is essential to medicine, and that is quite neglected in the curriculum, and that you will have to develop by yourself, and that engaging with the humanities, cinema in this case, but all the other humanities, is essential for you to be a good doctor, never mind a good person. And then there is a little bit extra, the 5th point, which is that I am hoping that after you finish this module, you have a better view of psychiatry. There is a lot of stigma in the media and in culture and in film about psychiatry that bombards people continuously about it. I want to make you see that, so you end up with a better view of psychiatry. That's my last of the 5 points. The second bit about the structure of the module is that I want to give you an idea of how we're going to work during this module, how we're going to learn from it. And the structure is a 4 parts, which is first you prepare for a session, then in the session we do watch a film together, then we discuss the film together, and then you go off and you follow up and you learn on your way. Yes, so 2 bits, the preparation and the after work, is for you to do if you want to. Yes, the 2 bits in the middle, watching the film and discussing, we do together. Yes, and every session will have the same structure. Now, I want to spend a few minutes on each of those. The preparation. The preparation is very important. You will learn later that learning happens in the interaction between the text and the context. So the context is what you've read. So if you've read a document that I give you about autism, and then we watch a film where there's autism portrayed, having read it or not having read it makes a difference between enjoying a film and learning from a film. So the preparation is really important. Yes. The second bit, which is the watching of the film, is also very important, and is deliberate, that we all get together, sit together and watch the film together. It is something that it was very normal for me growing up. That's the only way I ever saw films. I know that this is not the way it happens nowadays, but it's still very important that we have that communal experience of all watching the film at the same time. with that is the watching the film at the same time, not looking at the film whilst we're looking at the phone or doing emails, which is also what a lot of people do. I do sometimes, but not for this module. We need to be able to watch with full attention. And the next bit, which is going to be the discussions that we will have after the films, which are really, really important, which is that everybody will be invited to share their experience and their thoughts about what they've just experienced. And this is really important. And this will depend on you being able to understand, reflect on what you've experienced and communicate it. So there is the idea of you need to be able to reflect, to look at yourself and bring it out and communicating using the right language and the right attitudes. So for the language that we're going to use, we will have to learn some concepts that enable us to talk about films, which are not part of most people's upbringing. You know, things like being able to understand what montage and mise-en-scene and specific cinema language, which I'll talk about in another video. So being able to know what we experience when we watch the film, reflect it, and communicate it in a safe way. That's the bit on the discussion. And then there's the follow-up. So hopefully after preparing, watching and discussing a film, you will be interested in knowing more about things. And then I will hopefully be able to provide you materials where you can go and use that kind of energy that comes from the film and the discussion to learn things that you're curious about. And that you will do on your own if you can. Yes, so that's the method. The next bit is what's next. So what happens after you watch this video is there is more videos and links and bits for you to read for the whole module. So that will prepare you for session 1. And then in the next Friday we will have the first session where we will have the first experience of watching a film and discussing it together. So you need to watch the other videos that I'm recommending and read the papers. And that's it. I'll see you later.